Hello everyone. This presentation is on Tang, also called for substance decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Tang belongs to the category tonify blood. A representative pattern is blood deficiency with dizziness, pale complexion, dry skin, and scant menses. Important ingredients include Tang, Chuangshen, Bai Shao, Shu Dai Huang. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 38-year-old woman with menstrual-related blood deficiency symptoms. The current medicines are aspirin 81 mg, metformin, ferrous sulfate. This case gives a possible reason to consider Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Tang/Chuangshen plus aspirin. The mechanism is that both herbs are associated with blood-invigorating or antiplatelet effects, which may add to aspirin. The clinical significance is moderate, especially if bleeding is already heavy. My management plan is monitor for bruising, heavier bleeding, or black stools. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Shu Dai Huang plus metformin. The mechanism is that Rhythmania may have glucose-lowering effects. The clinical significance is low to moderate. My management plan is monitor blood glucose after starting the formula. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is iron timing plus herbs. The mechanism is that complex herbal products may affect tolerance of iron, or vice versa. The clinical significance is usually low, but practical. My management plan is separate ferrous sulfate from the formula if nausea or constipation worsens. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Tang may be reasonable when the patient truly matches the pattern blood deficiency with dizziness, pale complexion, dry skin, and scant menses. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.